5 minutes, really, Nurse Joma? How is that even possible? Well, just watch, take a look. You may be surprised by what I'm going to teach you through this video. So let's talk about how you're going to learn all the content on the NCLEX exam in 5 minutes. Now, first, let me say that what I'm going to teach you that you're going to learn in 5 minutes is a process, a system, a blueprint to learn all the information, right? Because one of the things that so many of you will tell me when I'm talking to different individuals at the beginning of their studying is, oh my gosh, I feel like I'm all over the place, right? Like there's just so many different resources, so many different things for you to utilize and everything. And so you're just really trying to identify what is the best course of action. How do I create a plan, right? What's the best method? What should I do? When should I start doing practice questions, right? So what I'm going to show you today is the blueprint to learning things, and that blueprint is what takes you 5 minutes. That blueprint of this 5-minute blueprint is what you're going to use to translate over to the content material, and that will help you to feel more comfortable, more confident in retention and learning everything you need to know when it comes to this exam. All right, so you ready to go? Let's do this, right? So here's one of the first things is that in order to learn the information, there has to be a sequence. There has to be a very particular order that you go through the information. And the issue for a lot of people, especially if it's been, time since you've been out of school, is that you don't know the right order to learning everything. And because you don't know the right order, that's why it's taking you so long to learn the information. That's why it's so overwhelming and frustrating, right? So if you will master the sequence, the order, it's going to become natural. Think about it like when you, up until this time, before you got into nursing school, and you go through the period first when you were like a child, right? You first had to go through elementary school, and then you had to, well, obviously there's school before that, but elementary school, and then middle school, and then junior high, same thing, and then high school, right? So there were all these steps that they took you through, and because you went through it in a very specific order, that's what led to your success. The same thing applies to the NCLEX. Now, if you just graduate from nursing school, they should have already taken you through the blueprint that I'm going to show you today. If not, you're going to want to take some notes and listen to this closely so you can implement it in your study routine moving forward. So what I call this is my 4 levels to pass the NCLEX exam. And I'm going to show you even like a picture that will help to illustrate this even better. Now, these 4 levels is really what's going to be your time saver. This is how you're going to learn, and this is what you're going to pretty much learn that's going to help you to save time, save energy, and know how to focus when it comes to the material. So we have at the very bottom, the first level, which I call the patho level. In this level, you're going to focus all about learning and making sure that you comprehend how the body works normally, how the body, the functions of the different parts of the body. How does the disease process change based on how does the disease process change the way the body works normally? That's your pathophysiology. This is the biggest area that you need to cover. That's why it's so big in the diagram, right? In the triangle. Then after that, from there you're going to focus on content level. Content level now is all about understanding how to medically manage these problems. So this is going to include pharmacology, this is going to include safety and infection control, and then also mental health or psychosocial integrity. Then once you master this area, now you're going to know how to think like a nurse, right? Now you're going to know how to do the appropriate nursing interventions. So this is going to be all about reduction of risk potential categories. So this is going to be your pre-op care, post-op care, labs, diagnostic tests, knowing of medical emergencies. This is also going to be management of care issues, right? Prioritization, delegation, and then finally basic care and comfort. So this is going to be your ADLs, positioning, diets, and more. right? And then finally, the last one is your test taking level. Test taking level now is going to be all about strategies and then answering, doing practice questions, and just learning how to think more critically. If you follow this order in this sequence, right? Learning that order, how long did it take us right now? 5 minutes, right? To learn that order. So now you're going to take this information and you're going to apply it over when it comes to the disease processes, when it comes to different parts of the levels. So for example, if I show you an example with the disease process, right? So there's an order to even learning the disease processes, right? So first you need to understand the pathophysiology of that disease. Then you need to understand the risk factors or the causes. Then you need to understand the symptoms that it will produce, signs and symptoms, and then finally you're going to understand the treatment. Let's do an example even with the medications, right? So with the medications, first you should understand obviously what is the medication, like the name of the medication, the generic name, also the trade name as well. Then from there you're going to understand the mechanism of the drug. So how does the drug actually work when it's in the body? This is not necessarily the same thing as the rationale, because there are different medications that can have the same rationale but a different mechanism. Then you're going to learn the rationale. So what is the purpose? Why do we give it? Do we give it to lower blood pressure? Do we give it to deal with pain, right? Then you're going to learn the side effects, right? So what is the side effects that will happen as a result of giving this medication? And then finally, you want to also be aware of how do I give it appropriately, right? The medication administration. What's the appropriate route and way to administer the medication? If you maximize on this order, this sequence, and you apply it, right? Because now we applied it to the diseases, then the drugs, right? If you apply the same thing now when it comes to nursing interventions and prioritization, and then finally you apply it to strategies, not only are you going to retain the information faster, better, but it's going to make a lot more sense to you because now you're learning it in the correct order. All right, you're learning the correct order. So I really want to encourage you to implement this blueprint. It's the same blueprint that I use with all of my clients, people that I'm working with one-to-one, privately through mentorship to help them to pass their exam, that have struggled to pass it before, as well as also first-time test takers too. If you want to receive mentorship from myself, if you just click below this video, either below or above, you can go to bit.ly/pass NCLEX, and we can schedule a free NCLEX strategy session so we can see if you're a good fit and I can work with you. And I also want to encourage you as well to join our private Facebook group below, which is called NCLEX Prep for Success, where you can get more trainings, longer trainings, deeper trainings from myself completely for free. All right, click below above this video as well. Thank you so much for watching. Subscribe, like, follow, share this, tag someone that would benefit from this information. And I hope that you found it helpful, and I'll see you the next time.